Okay, so my 12 patient rights are, or safety rights are, verify care / order for the patient, perform hand hygiene, verify facility policy, verify recommendations of the manufacturer, knock on door, identify patient using 2 forms of identification, explain procedure to the patient and provide privacy, no overall care of patient, elevate bed to promote good body mechanisms, don PPD if indicated, lower bed, raise side rails, and provide the patient with call light, and report any abnormal findings to your charge nurse. My 6 medication rights are right drug, right dose, right time, right route, right patient, and right documentation. So I have a order to insert an NG tube for intermittent suctioning due to no bowel movements for 8 days. So I'm going to come in the room, perform hand hygiene, and put on some gloves. Prior to inserting the NG tube, I'm going to assess the patient. First I'm going to assess his abdomen. I'm going to auscultate for any bowel sounds, make sure there is some bowel movements. I'm going to observe it, inspect it for any distension. I'm going to ask the patient if he's experiencing any pain, assess if there's any tenderness. I'm also going to ask the patient if they've had any facial surgery, specifically any sinus surgery, some serious deviation of the septum, and then I'm going to assess his mouth. So ask him to open his mouth and with the tongue blade push his tongue down, see if there's any lesions or sores, and then I'm going to do a nair test to decide which nair I want to use for the NG tube. I'm going to occlude one nair, have him sniff, occlude the other one, have him sniff, and then from there we'll decide which nair to use. At this point, the patient's going to be in a high Fowler position. This bed is not able to demonstrate that, but it will be in a high Fowler's position. Once I've assessed, I'm going to measure my tubing. So first I'm going to start at the nair, go to the earlobe, and then from the earlobe go to the xiphoid process. I'm going to take that off, and then I'm going to lubricate my tubing. I'm going to ask the patient to tilt their head backwards, and I'm going to start administering the tubing and ask the patient to let me know whenever it hits the back of their throat. When it does hit the back of their throat, I'm going to have them move their head forward, chin to the chest, and at that time I'm also going to give them some water, preferably ice cold water to help give him like a numbing sensation, and as he's swallowing, I'm going to administer the rest of the tubing. Okay, this tubing doesn't go all the way in. Then I'm going to tape the tubing to his nose. And then I'm going to tape the tubing to his gown as well. So I'm going to ask the patient to move their head from left to right to make sure that there's some leeway for him to move his head around. And then I'm going to tape it to his gown. Also, you want to check for placement. The doctor should have put an order in for an x-ray, but until that time you want to check placement in regards to gastric secretions and the pH levels. So you're going to want to check that. You're going to take your bubble syringe and take out some gastric solution, and then you're going to put it on a pH indicator, and it should be below 5.5. If so, it is in the right placement. At this time, you want to attach it to the suctioning. Attach it to the suctioning. You want to set it to intermittent. You're going to assess the patient, make sure they're tolerating it well, that they remain in a high Fowler's position, or at least 30 inches. and then document your procedure. And then I have an order to perform a gastric lavage. So I'm gonna come in, perform hand hygiene, put new gloves on, assess patient, send the procedure to them, disconnect from the sectioning, and then I have some 0.9 normal saline and a suction and a container for the content. So I'm going to administer my normal saline. Administer my normal saline, and then I'm going to take it out and put it into this container. I'm going to do this until the fluid in here is a clear or light pink color. Once it is, then we're done with that. So I'm going to connect this back to the suctioning per doctor's order. Assess the patient, make sure they're still doing well, document my findings. Now I have an order to administer Glucerna, 100 milliliters. So I'm going to come in, perform hand hygiene, put new gloves on. First I'm going to disconnect the suctioning. And then I'm going to remove any residue, and I want to make sure that it is not more than 150 milliliters per this order, but permissiorly it's less than 250. So what I'm going to do is I'm going to suction it out into here and just make sure that it's not more than 250. So it's not. So now I'm able to administer the Glucerna. So what I'm going to do is I'm going to put this content back into here. Once I've done that, I'm going to flush the line first with water. You can use water. So I'm going to clamp it, and I'm going to put 50 mLs of water, and before the water line goes down, I'm going to start administering 50 mLs of my Glucerna, and that way I'm not letting any air bubbles get in. Once the 50 is down to the bottom line, I'm going to administer another 50. Same thing, not letting any air bubbles get in. I've now administered 100 milliliters of Glucerna, so I'm going to flush it again with 50 mLs of water. Okay, so now that I've administered the Glucerna, I'm going to take this off and apply the suction, or just clamp it off per doctor's order. I'm going to assess the patient, make sure they tolerate it well. I'm going to document all my findings,